Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 8, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. 6 new cases were added to Dubuque County's total today. As of May 8th, Dubuque County has 181 positive COVID-19 cases. That's a rate of 187 per 100,000 population. To date, we have a total of 6 deaths in Dubuque County. Also, 1,820 people have been tested, and almost 10% of the cases tested have been positive. The state has updated the Coronavirus Iowa website, so not all of the data I usually report on is available at this time. The state did add 398 positive cases today for a total of 11,457. And I'm sorry to report 12 additional deaths are in the state today for a total of 243 Iowans. In all, there have been 70,261 tests, and about 16% have been positive. Currently, 407 cases are hospitalized, and 4,685, or 41% of Iowans, have recovered. I've mentioned in the past how things keep changing with this pandemic, including guidance from the Center for Disease Control, or CDC, and the Iowa Department of Public Health. CDC has added symptoms to COVID-19 for screening purposes. According to CDC, COVID-19 symptoms may appear 2 to 14 days after exposure to the virus. People with symptoms or combinations of symptoms may have COVID-19. They would either have cough and shortness of breath or difficulty breathing, and at least 2 of the following symptoms. And these are what's been added. In addition to fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. I've been hearing about people who think they've had the virus, even long before it was documented in the U.S. Famous celebrities, local folks, college students. Even though it's hard to believe a virus can spread worldwide as quickly as the SARS-CoV-2 has since it was first documented in Wuhan, China in November, this scenario has been predicted for years by leading public health experts. Health departments everywhere, including our own health department, have been making plans for outbreaks and pandemics since at least early 2000. So this virus spreading as quickly as it had is very plausible. The Washington Post recently had an article about this topic. In fact, they've noted a new condition called "think I had it-itis." It's when people who've had COVID-19-like symptoms long before it was discovered think they actually had the virus. Many people living in the U.S. have done media interviews describing their symptoms and stating they're positive they had the virus back in November or January, etc. So one of the first reactions of "think I had it-itis" is, "Great, I'm done. I've beat it," which is then followed by, "Oh my goodness, what if I gave it to a bunch of people?" "Think I had it-itis" also reminds me of when I was in college for nursing, and I was learning about various illnesses and diseases. I usually thought I had the symptoms of many of them and immediately began self-diagnosing. After a while, I learned to tune those thoughts out. There are people who've had the virus and were asymptomatic and therefore didn't know they had it. We also know that there are a multitude of allergies, along with respiratory viruses and bacteria that infect people and produce similar symptoms to COVID-19. Keep in mind that CDC reports that overall 20% of COVID-19 tests are coming back positive, and that's now that we're in the pandemic and primarily testing sick people. The only way to beat "think I had it-itis" is with an antibody test, which shows past infection. However, even the current antibody tests have their limitations with reliability. The bottom line is, "think I had it-itis" can cause anxiety and uncertainty, so try not to catch that bug. In closing, as the weekend is here and quite a few retail stores will be opening up, Let's all continue to be cautious about visiting our favorite store or venue. Chances are everyone else is wanting to do the same thing. I know you haven't been to TJ Maxx for 2 months, or you desperately need some new shoes, but try and wait until the initial rush is over. It will give our retailers a chance to get used to the new distancing, extra public health measures, and occupancy limits they will all have to comply with. Thanks for tuning in today, and to all the mothers out there, happy Mother's Day on Sunday. Let's all continue to be safe, be smart. When in doubt, don't go out. Remember, we're all in this together.